Okay.
5, 4, 3.
I'm joined now by Mike Frierson, Michael's father, and colorectal surgeon Dr. Zuri Murrell. And I want to thank you both for being here and for having this conversation. And Mike, we of course knew Michael very well here as coworkers, as his friend. But for those who don't know him and didn't get the chance to know his light, can you tell us more about your son?
Yeah. And first of all, I want to thank you for inviting us and having us here and taking us on for it. We had a tour of this building, and it's just unbelievably spectacular. One of the sad things is that Michael didn't get a chance to see this building, and he really, really, really wanted to. To speak about him, I mean, you know, my son Michael is a remarkable, remarkable man. And first of all, I want to say I'm not here as a grieving parent. Okay, I mean, you know, we had some great years with him, especially even the latter part of it before he died. And he was just, once again, a remarkable person. He was my best friend. And I say that, I don't say that lightly. I mean, he really was a person that I would go to for information. And, you know, he was that way from the time that he was born. He was just that kind of person that was, you know, everybody was very attracted to him. And he always made everybody feel like, you know, he was your best friend.
Yeah.
So
I can tell you this, though, for those of us who had the pleasure of meeting him, that energy that you spoke of has translated to this building. So he's still very much here, and we very much feel him. So completely understand what you're saying in that respect. Dr. Z, how common is colorectal cancer?
So colorectal cancer is very common, actually, in America. So it's the #2 cause of cancer-related death for both men and women in this country. Third most common cancer in women, the third most common cancer in men. But when you look at cancer death, it accounts for #2 in this country. And the sad part is it's almost totally preventable. You know, now there'll be about 150,000 newly diagnosed patients this year with colorectal cancer, about 50,000 deaths. And so it's hard to jive, right? I'm telling you it's almost completely preventable, yet it's responsible for so many deaths. And so the reason that is because of a lack of information, knowledge. And also, it's fear. You know, I always tell people you shouldn't die from fear and you shouldn't die from embarrassment. And people are afraid to discuss this particular disease. They don't even like to say the words.
Sure.
And it's very important that patients think about what they're putting in their body, which can help prevent cancer, vitamins they take, which can help prevent cancer, fighting obesity, which is a huge epidemic that is responsible for many cancers, and also getting tests like a colonoscopy, which actually is not done to find cancer, it's done to prevent cancer.
Wow. So for those at home who don't know, colorectal cancer was the cancer that Michael battled. At what age can and should people be getting a colonoscopy, Dr. Z?
So that's a complicated question because the age I think they should is a lot different than the age that is recommended. So the recommendation now is age 45 for a screening colonoscopy. What does that mean? That means that there's no symptoms. That means that you have no family history of colon cancer or colon polyps, and that you have no symptoms such as rectal bleeding, such as changes in bowel habits. So then it's age 45. A lot of us don't know our family history, #1, okay? And family history really only accounts for about 8% of colorectal cancers, okay? A lot of us are afraid of, or we don't think that some changes in our bowel habits can matter because we think, oh, well, this happens from time to time. And even bleeding, a lot of times we think it's from hemorrhoids or something that is not pathologic. What I tell patients is knowing your body means that if there's changes that last longer than about a month, you need to be checked out. You need to go to a physician and you need to have that investigated. Don't just think because you're this age, because you're young, because you don't have any family history that this cannot happen to you. And that's really the key, because the reason I am a colorectal surgeon is because even if we catch this disease early, we can cure you. Wow. And so that's why it's very powerful. I hope no one ever gets it, however, if you do get it, it's important to have it caught early. And that's the hardest part with young people like Michael, is that a lot of doctors, we don't even think about it in this age group.
Yeah.
And also, Michael, sometimes you can have a genetic predisposition that skips your family, so you don't even know. And that's what's really important.
And that's why the word should there is so important, because you have to advocate for yourself in certain scenarios. Yes. Mike, how can someone become a healthcare advocate in this sense?
Once again, the promise that I made to Michael was that I didn't want to see anybody else under the age of 40 die from complications associated with colorectal cancer. I truly believe that people should get a baseline colonoscopy at age 30.
Wow.
Now, that's not driven clinically by any reason. The only thing that I can tell you is that we have this technology that allows you to see inside of your body. I mean, we walk around here every day, we think we're healthy, but we don't really know. And we have a technology that can tell you whether or not you have this, this capability of contracting polyps. Now, we can control it. I mean, if we can catch the polyps early enough, we don't have to worry about this colon cancer issue. So I'm an advocate for people getting a baseline colonoscopy at least at age 30.
You know, it's very layered, and there's a lot of factors that go into it. You mentioned family history, your own predisposition, but that's why the conversation is so important. It can be very taboo because of the part of the body that it is. But Mike, what is the one thing that you want our viewers to take away from this interview, if nothing else?
Definitely get a colonoscopy as early as you possibly can. Michael was diagnosed, I believe, at age 32, 33. Wow. He was dead by the time he was 38. Yeah. Chadwick Boseman was diagnosed at age 37. He was dead by the time he turned 44. Right. So to me, a simple $1,500 colonoscopy is worth finding out whether or not you fall into that category. Because I'm going to tell you, the thing that was the most disturbing about this situation with Michael is watching him die and how he died. Because it's not a pretty thing to see. Right. And I'm sitting here telling people, as somebody who was there throughout the entire process, I wouldn't want to see any parent, I wouldn't want to see any family member suffer through that, and suffer through it, number one, but secondly, having to watch somebody suffer through it.
Yeah, and that's the reality that a lot of people don't want to hear or simply don't hear. Dr. C, what steps can someone take? We've talked about screenings here to prevent colorectal cancer. Okay,
so there's things that you can do something about, and there's things you can't. You can't do anything about race, you can't do anything about age, okay? But you can do things such as fighting obesity. Mm-hmm. So obesity in and of itself is a pro-inflammatory condition, which means that your body is basically fighting itself so it can't fight genetic changes, okay? That's number one. So exercise, things of that nature, physical activity. Those are some of the hardest things to do, though, obviously. Mm-hmm. Something else that is tangible is vitamin D. So vitamin D, you can find it anywhere now. You can vitamin D gummies, things of that nature. We are chronically, African Americans and really all Americans are chronically vitamin D deficient because vitamin D is made when you're out in the sun hits your skin, your body makes vitamin D. Well, COVID happened, right? And even before COVID, nobody's going outside. Mm-hmm. And most people don't really work outdoors anymore. So that's something else that you can do tangible. Something else, doctors always say fruits and vegetables, right? The reason that happens is fiber. Fiber helps us eliminate waste from our body quicker. The best way to get fiber, in my opinion, okay, because when I was younger, I used to think fiber was for old people. Now, I guess I'm becoming one of those people. But blackberries, blueberries, raspberries, 7.2 to 7.5 grams of fiber per cup. Okay, we need 20 to 25 grams of fiber a day. Every morning, I make a smoothie that has that in there. Okay, so these are things that you can do. Also, the colonoscopy. Now, here's the thing with the colonoscopy. The reason it's so powerful, it's the only test that prevents cancer. We make patients get blood tests. We make patients get CT scans. And that's just to discover a problem. Okay, my mom passed away from breast cancer, had mammograms to find the problem. Could not treat it. With a colonoscopy, all colon cancer starts as these little growths called polyps. Polyps have no symptoms, no signs, okay? I had a large polyp I did not know about. I practiced everything. I preached, but I knew my family history. I knew my father had a lot of polyps. So I got a colonoscopy early, and I found a huge precancerous polyp that if I would have waited till I was 45, I would have had colon cancer. And so the colonoscopy helps prevent it because you take the polyp out before it becomes a cancer. And I think that my real take home is you try to do everything right. You try to do nutritional aspects. You try to decrease your processed food consumption. We're seeing a 12-fold increase in people younger than 45 getting colorectal cancer. Wow. That's because of the obesity epidemic. That's because of the high consumption. 75% of kids' diets up until the age of 18, 75% are high processed foods, which lead to cancer. Lastly, consumption of red meat. Oh. Red meat consumption, the way we break down red meat is into something called a procarcinogen, which basically means if you eat enough, it can lead to cancer, okay? So these are things that we can do. We can make tangible efforts to do this. And the most important thing is that what we eat at the dinner table will help us, but it helps our children. Our kids model that. And that's really the key, because we're seeing this disease more and more in people we never seen it in. I've operated on so many patients now who were like Michael. The problem is, when you're young and you get colon cancer, even a lot of us as physicians don't even think about that. And so by the time they're diagnosed, it's kind of far along in the game. If you're diagnosed early, this disease is 98% curable.
That's a huge percentage.
That's a huge
Dr. Z.
percentage.
Wow. It's a lot of information to
Yes.
take in, but the purpose here is to inform and
Yes.
hopefully enlighten and help someone else out there.
You have the power.
Exactly.
That's the key with this, is that you have power to make a tangible difference in your healthcare and your generation's health status.
Yes.
And I can say one thing. See, I wasn't supposed to be here. This was supposed to be the Michael and Zuri show. But since he didn't make it, I felt that I had to, take charge and at least come out here and be a spokesperson for him.
Absolutely. And we appreciate you being here. It means a lot to us here to see your face, and we feel Michael through you and your wife who are here. So thank you both for this conversation, for the information, and for informing all of us here to do better. Dr. Z, Mike Frierson, thank you so much.
Thank you.
Perfect. Love that.
Thank you so much. It's such